There are many programs around the world that we can learn from in order to provide healthcare in a more universal way. Because actually, my concern isn't limited to the undocumented, although the undocumented are a particularly vulnerable population, but all vulnerable populations, whether they're elderly or they're differently able or they're just poor, all of them need a system where they will all be cared for. And so I think that there are many different examples around the world. I had experience myself personally with the system in Israel. This was a couple of decades ago when I was very young, and I was in Israel and I got hurt. I had an accident, and it was so impressive to see the kind of healthcare that they had because it was very universal, it was very accessible, and what was very clear about it was that the physicians and all of the medical personnel were very invested in the well-being of the community, that this was not a business. And I was amazed because here I was a foreigner, I was there, I didn't have any claim to be given really great care, and yet I was provided very good care. And one of the things that I found fascinating was how in their main hospital in Jerusalem, they had these smaller clinics where this clinic deals only with hands and issues, and my accident was with one of my hands. This clinic deals only with issues of throat and nose. So there are amazing ways that health systems can organize themselves to really serve a wide population, which should not exclude, in my opinion, anyone, period. Well, I think the United States needs to rethink what we mean by healthcare. Do we mean something like the Titanic, right? That we have the very rich at the top, they're going to get the lifeboats, and they're going to get off, and they're going to be okay. And then we have different levels of people depending on how much money they have and how much influence, where we have the bottom, the poor, who are just going to die because we're not going to provide them any help. I think that we don't want to be the Titanic. And I think that the United States, as a beacon of hope and a beacon, an important exemplar to the world, should make it a priority to say, hey, let's rethink the way that we do things so that we don't have this business model for healthcare, but we have a model that's predicated on the common good. And I think that then brings with it a lot of different requirements to make a commitment to that common good. And taking away the incentives of profit. We've recently had issues here in the United States about exorbitant amounts of money for things people need, like EpiPens. My son needs an EpiPen. Well, who's making that money and why? This is not necessary to develop this medicine because this medicine's already been developed and it's in wide use and it's necessary. So what's the bottom line here? And I think we need to rethink what's a profit business and what is a service that's dedicated to the good of the community. And these are not the same thing. I don't think we should ever put a physician in the position of deciding that someone gets care or doesn't get care based on economics. That should be something that is taken off the table completely. And really, in truth, when a physician or a healthcare worker become a healthcare worker, they do so out of a desire to help their fellow human beings, not out of a desire to make money. And so I think the first thing has to be that kind of either incentive or burden has to be removed from the medical community. And that has to be taken, I think, by nonprofit structures that then make sure that we have the resources necessary to do the kind of thing we need to do. When that physician then has someone come to them, again, I don't want them to have to say, you don't have money and you don't get to have care. I want them to be able to say, let's see how we help you. And I don't know myself how I could make such kinds of determinations and feel that I am acting in a way that's coherent with either an open society that says that it cares for all its people, and myself as a Christian theologian, someone who believes in a foundational document that says we are all made in the image of God. The image of God does not carry around a wallet, and we should not have that predicated. Now, that's the economic side. On the documentation side, clearly, it's the same thing. We can't put on a physician the burden of asking someone, do you have legal papers or not? And you know, if we place ourselves way off into the future, and I like to do that, you know, I like to just look back like this is the past, put ourselves out into the future and say, we're telling this story, and we're talking about a time when people were actually turned away from getting health care because they happened to be born on the wrong side of a border. How barbaric is that going to appear to generations in the future that we would have made those kinds of decisions? These are human beings, number one. That's it. The rest of it, we need to work out as a society that makes a social contract to care for one another. And I think a lot of other people would be very willing to live more simply and to have less fancy stuff so that others can have more. And I think that that's the switch we need to make, right? I mean, I'm a cancer survivor, and it breaks my heart to think that I have survived through something because I live in a country with great health care, and my organization provides very good insurance and all that. I've survived it. But how many women with exactly the same condition that I have around the world have died without any opportunity at all? And that breaks my heart every time I think about it. It seems unjust, unfair, and certainly for me an affront to God and to God's plans for humanity's flourishing. And so as a cancer survivor, I want to be able to say everyone should have the same opportunity to survive that I have had. Well, when we think about immigrants, we have to realize that there's different ways of migrating. You know, there's the immigrant who comes, who has a lot of education, who has a good job, who's going to, you know, move into a good position, and they're going to be very analogous to Native people in the kinds of resources that they have. But then we have the immigrant who's a refugee, the immigrant who's in exile, the immigrant who is just eking out a living, who may not even have the documentation to actually have an actual job and is putting together little jobs to survive and caring for a family. And when we look at that picture, we say, okay, what we're looking here at is the most vulnerable people in our society. Forget immigration status or non-immigration status. Just think about the resources that this particular human being has. And how do we make up the difference from what they would have were they to be able to have a good education, a good job, all of that? How do we make up the difference and make sure that they have something that, for me, is the fundamental human right, which is the right to health. And just as you know, we think, you know, we have a right to be free and a right to freely worship. Well, a right to be a healthy person and to survive should be one too. You know, as a child, I was an asthmatic, and I hate to think what would have happened to me without my rescue inhaler, right? I wouldn't be here now to talk with you. So what are all of the things, the little steps along the way of someone's life where a health concern would stop them, would end their life, or would significantly change it? And how much human capital are we losing because of that? And so I think it behooves any society to invest in its people. And healthcare is an investment in our people. The bulk of my experiences on the issues of healthcare have been with custodial workers and janitorial workers. And they may themselves not be undocumented, but live with a lot of family members who are. They're persons who are unfortunately at the bottom of the ladder in terms of the kinds of salaries and resources and support that they have. And working with them, just trying to navigate, for instance, a set of medical claims, right? So complicated, so difficult for me, let alone for them. Things like disability insurance. I work with a group of other cancer survivors where we try to help each other to make our way through these things. So we need to simplify things so everyone has a way to access things, and then we need to make them accessible. Because the bottom line has to be that no one should have added to the issues of their health, the issues of how do I navigate the system or how do I pay for this. Let's just try to get you well and not add all of these heavy burdens, which is what I see when I work with the custodians, is these other questions. Sometimes they will tell me, they say, I was not feeling well, but this has really added to my level of stress and to my level of feeling sick because I can't understand any of it. From a Christian perspective, I feel that Jesus leaves us no wiggle room on how it is we're supposed to care for each other. He's very clear. And he repeats it in multiple ways. And he enacts it in multiple ways. He tells us the story of the Good Samaritan who not only stops to care for the one who is hurt, but then invests out of their own pocket in paying for the care of this person and makes sure and invest their time to make sure that they're well, right? So Jesus tells these stories over and over again in a community and in a time when, being sick was something that pushed you all the way out of the community, right? You were not even welcome into the walls of the city. For him, I think sickness is a marker for people being dehumanized. And so from a Christian perspective, we have to, as the entire point of it being that we are disciples, right, that we do as he does, we have to pay very close attention to what it is Jesus says and does in relation to the sick, in relation to the poor, in relation to the most vulnerable. They're always his priority. And as we understand all of this to work, as we're listening to Jesus' priorities, he's giving us God's priorities, right? He's transparent to God. And so what we're getting here is, this is God's priority. God has made everything good, everything wonderful, everything fragile, everything vulnerable, because it's alive and it's free. And all of that makes it for a complicated cosmos. And this complicated cosmos needs us to do our part in it. And that part is the care, the love. We have this beautiful phrase in scripture repeated many times of God being love. And The idea being that every time we enact an act of loving kindness, we are making God present. So what place is there more of that possible than when we're caring for the sick? That is a moment when a human being is the most vulnerable, and when God's presence can be made the most visible by our care for them. And so I think that the care of the sick has always been understood as a central tenet within the Christian tradition, and I think we should apply that to our medical system as well.